Well, I had serious knee pain in both knees, and I visited with Dr. Desman, and he did an arthroscopy on one of them, and he told me this was just a temporary solution, that my knees were bone on bone after x-ray review, and at some point I would have to have a knee replacement. Well, that point came quick, and I decided to go ahead and do the outpatient knee replacement. I chose outpatient because, well, a couple of reasons. I think it's more efficient. It's very convenient here. And more importantly, during the height of COVID, I thought it would be a safer environment, having fewer people, fewer patients, and not a hospital type environment. The experience was fantastic. The thing that amazes me is this whole process. I was very concerned about it. It's a pretty major surgery, but they have the procedures down where you just follow the procedures from before the operation, during, and after, and even through the therapy. So if you just follow the steps, everything works out great. Well, the original one, I'm 7 weeks out, and this knee and this leg has been helped me with the new operation on the left knee. Feeling great. I don't even notice I have a new knee, really, other than the arthritic pain is gone. So now I can focus on this other knee. Getting back to golf, fishing, boating, getting back into regular activities. I've been able to do, pretty much household chores and things in the yard, but very carefully. But I'd like to become more active. I already have several friends that have been inquiring on how it's gone. I would say absolutely do it. You're going to have some downtime, which makes sense. But if you follow the therapy, and that's a must, absolutely. A lot of people are hesitant about doing physical therapy, but I'm convinced that really makes it better and faster. So I encourage people, if they're in the same shape that I was with my knees, bone on bone, definitely get a replacement, especially while you're younger and healthier. I couldn't rate them higher. They've been fantastic. From the office visits to the administrative staff to the nursing staff, and through the whole procedure, everything went just by the numbers. And they even called almost every day after the surgery to just see how I was doing. And if I was okay on pain or swelling, and everything went smooth. Also they arranged home visits for a nurse and a physical therapist for the first week, which was extremely helpful. They've got procedures down. They got a blueprint on how to do this thing. And being a retired private pilot and a boat captain, I like procedures. And there wasn't a step that I had to worry about. And it convinced me the second knee is going to be done as soon as possible.